I want to thank everybody for attending this presentation on FDA 43s in the laboratory. What we're going to be talking about are some reviews of current issues as seen by the FDA when they do their audits or inspections. And we broke down the data. Here is a breakdown of the data for FDA 483s, and we looked at roughly 216 inspections, a little over 2,200 observations in total, and broke them down into the areas, the pieces of the pie in which the observations were made. Roughly 20% fell in quality, 21% in facilities and equipment, and 21% in the laboratory, 18% roughly in production, materials at 12, and then you've got a few little things, packaging and labeling at 5, and then a mishmash of other things just came up to about 3% of the total of the entire pie. Breaking down this further, we'll go to the next slide. And this broke down the laboratory system. 216 inspections performed, just under 500 observations in total, 477. Broke it down into where are the major areas of flaw what people are having out there, and this is what the FDA picks up on in data and they focus on. So 35% fall into controls in the laboratory, general control systems. You can't lump them all together. It's 35%. That's a pretty significant portion falling into that piece of the pie. You've got 27% in inadequate records or SOPs. The SOPs, the data that you're keeping out there, are just not capable of doing what they should be doing. Collecting the data, the procedures aren't clear, they aren't complete. That falls into that huge piece of the pie. Your stability program comes next, 21%. You get some method validations and then training and qualification of people into that 4%. Still coming in there. It's not as big as anything else, but it's certainly a piece of the pie. Method validations, kind of surprising. It should be something very easily put together now. But the controls in the laboratory, that's really a key thing out there. Looking at contract laboratories, breaking down the data for this. The laboratory in essence itself, just the controls in the lab, 53%. You get quality at 21%. You get facilities, equipment, 14%. And you get a mishmash of other things in there. But just the general laboratory itself had over 50% of the observations in just the ability of the laboratory. It really details to people they need to be out there looking at these contract labs. They need to go in there and see what is going on, look at it, and understand, is this a place where we want to send our samples to be tested? There were 71 observations. There at the bottom of the slide, you can see that this is where this is broken down, so you can understand the numbers that you're looking at now. But it's surprising. You need to have auditors go out there. You need to contract with people to go out there and look at these contract labs. Someone needs to be in there looking at this. There's really no excuse for a company using a lab that they haven't seen before. They need to be out there checking those folks out. Now breaking down citation by system, the 6 systems from the FDA. If you break this down, you look at it, 26 warning letters over a 3-year period. This is where the data starts coming together now. Look at this. The laboratory is a huge type of process. This is yellow is 1 year, red is the 2nd year, green is the 3rd year. This is over a 3-year period, going back 3 years. And it tells you really where the issues happen to lie. Laboratory system, production system are major issues in this area. If you look at that, those are the biggest columns, followed closely right there by quality. If you look at materials, facilities, packaging, and labeling, those are smaller, not as bad. Again, this is 26 warning letters over a 3-year period, just breaking down what it is that we're seeing here. And production, And laboratory areas are key target points. Now let's look at these warning letters a bit more. 26 warning letters issued. Quality or production or the laboratory is cited in every letter. 26 of 26 warning letters had one of those three items in it. Quality was cited in 20 of 26, production 18 out of 26, and the laboratory 17 out of 26. Quality and production and the laboratory were cited in 10 of those 26 items. Really a significant breakdown. 10 out of 26 included three key areas of the systems that the FDA defined. All three areas were in violation, which is incredible if you step back and start thinking about what it would take for all those things to break down. Now let's break down the warning letters here. We're going through some of these things. Warning letter A, it's a drug product manufacturer. Failure to conduct performance qualification on the laboratory instruments, HPLC, GC, that are used to analyze raw materials and finished product. They didn't do performance qualifications. PQs, failure to validate the software programs used to run HPLC equipment. Software used doesn't secure the data from alterations, loss, erasures, all that other stuff. There's no ability for the company to have a tracking system or a data trail when things were altered. Warning letter B, a drug product manufacturer. Failure to calibrate the HPLC used for testing in process lots. It wasn't calibrated. PQs didn't include critical chromatographic specifications. You've got to include that when you're looking at that type of system. There are no SOPs requiring calibration of lab equipment. Nothing was there. It may have been done. It may have been perfectly fine, but you didn't have a procedure on it. What would you do? Warning letter C, a drug product manufacturer. Failure to establish SOPs or document the performance qualifications and maintenance of analytical equipment used in the testing and release of the drug product. It's incredible to think about people doing this type of thing. Another warning letter, letter D here. Broke these down obviously just to protect the innocent. Drug product manufacturer. It's a failure to validate the dissolution test method used to test the drug product. If you see a theme in all this, you're going to be correct. Talks about validation, qualification type items. There is no assurance that qualification or maintenance of lab equipment can consistently produce valid and accurate analytical results because of numerous instrument malfunctions. Incredible. You cannot just go on ad nauseum forever with issues like this going on. Warning letter E, contract lab. No established procedure for the qualification of analytical instruments for drug testing when purchased and installed in the laboratory. And it's incredible that there's no validation, no qualification of these types of things going in all these warning letters. Here's a 483 observation. A, from a company, a drug product manufacturer. Several major lab instruments, HPLC, AA, etc., have not been qualified, installed, operational, or performance qualification. Incredible. System suitability tests are not performed for several methods. Just basic laboratory setup. Observation B for 483. It's a contract test lab again. Routine calibration, inspection, checking if the equipment is not performed according to an SOP. Major lab equipment have not been qualified, IQ, OQ, PQ. Incredible. Another lab not having basic validation or qualification practices in place. 483 observation C, another contract test lab. No performance qualification conducted on several instruments. GMP versus non-GMP laboratory studies being conducted without really understanding the difference between what's required in those two types of systems in which you get just stuff in to evaluate versus GMP releasing of data. 43 observations. Another company, A, drug product manufacturer, for HPLC instrumentation used for drug product testing, there was no documentation available which was approved by appropriate people showing that HPLC was fully qualified. This included quality assurance. It included lack of written and approved installation and operation qualification documentation. You can't do things without documenting what it is you're doing. FDA's expectations for laboratories. This is specifically addressing lab type issues. There are various things I put down here for you to look at. These are FDA expectations. You have to do these things. There's text on validation of analytical procedures in this ICH guide, Q2A, Q2B, the validation of analytical procedures, the methodology. There's FDA guidance for industry analytical procedures, method validation. There's reviewer guidance validation of chromatographic methods. November 1994, a number of years ago. USP, NF, chapters 621, 1225. This is just a few little layers of what the FDA's expectations are. You have to go out there and make sure you understand what it is you're required to do. FDA's expectations continued with this. Each ANDA must include analytical procedures necessary to ensure the identity, strength, purity, quality, potency of the drug. Data must be available to establish that the analytical procedures used in testing meet proper standards of accuracy and reliability. And there's a section of the code. This is put in blue in this text here. All analytical procedures are of equal importance from a validation perspective. In general, validated analytical procedures should be used. Doesn't matter what it is you're using it for. You have to use the right method to get the data. Validation should not be a one-time situation to fulfill agency filing requirements, and then you go off and forget about changes, you forget about upgrades and systems, and then you never go back and validate it. That's where people fail. The applicants should submit information on the validation characteristics of their proposed analytical procedures. And I'm going to go to the blue section here. Typical validation characteristics are accuracy, precision, repeatability, and intermediate precision, specificity, detection limit, quantitation limit, linearity, range, and robustness. Basic things that you have to go through and look at. Continuing with FDA expectations, all chromatographic analytical procedures should include system suitability testing and criteria across the board with that. A listing of all equipment should be included, as well as a list of equipment parameters, flow rates, temperature, runtime, whatever it is. Validation of compendial methods should be performed. I'm not going to read through each of these bullet points here. You can see them. You can go back and look at this. Here they all are. The last bullet point, system suitability tests verify that the resolution and reproducibility of the chromatographic system are adequate for the analysis to be done. System suitability is not validation. It can be part of it, but it's certainly part of just routine testing. Conclusions. Certainly do your homework prior to method development and instrument purchase. Method validation and instrument qualification should focus on suitability for the intended use. IQ should be clearly identify the calibration, maintenance, and the SOP. Do you have an SOP? And the training needs. OQ should ensure proper function of all the system components. PQs should ensure suitability of the entire system. Not just one component of the system, but the entire system working in unison. Develop and validate methods using appropriate system suitability tests. And make sure you go back to the PQ. It has to be holistic if necessary. OQ modular to identify problems, initiate repairs, whatever it is. Make sure you have a good system in place. If you have questions, if you have comments, we're certainly happy to help you. We offer a free phone consultation. If you are having questions, if you're having issues, if you want to just resolve a debate that is going on in your company, give us a call. We'll set something up with you on a phone conference. We'll get the right people involved with it. We'll go over this and make sure that we give you a response. That way we can help you out. Give us a call. You can give us an email at any of those things. I highly recommend that you go to our website. It's compliance-insight.com. There's a lot of useful information there. Give us a call. Go to the website. Send us an email. If you need help, get a hold of us. Again, we offer a free consultation over the phone with these types of issues. Let us know if we can help. Appreciate any feedback, any comments on this. We're always looking for guidance from people on maybe things that you see out there. Help us out, help other people out, and we'll help you out as well. Thank you again for going through this presentation. We really appreciate it. And if you're having issues out there, good luck. I wish you the best. Give us a call. We'll see if we can help you out on it. Thank you, and give us a call if we can help.